Are you dealing with constant body stiffness that no amount of stretching seems to fix? You move, you stretch, and it's still there. Hello, I'm Dr. Adam Barron. As a rheumatologist physician, body stiffness is one of the things that my patients most commonly complain about. And here's what most people don't realize. Stiffness isn't just getting older. Stiffness can be a clue to what's going on with your health. Let me tell you about a real patient of mine. This woman came to see me after 3 years of overall body stiffness. She'd been to multiple doctors, all her blood work was normal, imaging tests were unremarkable, there were no signs of arthritis, muscle, or neurologic disease. When we sat down and went through her medication list carefully, one thing jumped out. She'd been on a statin, a cholesterol medication, for a long time. So here's what we did. Working with her primary care doctor, we did a 2-week supervised trial of stopping the statin. Her stiffness completely disappeared. Her primary care doctor then found her another medication for cholesterol treatment, and the stiffness did not return. This is why medication review is so important. Sometimes certain problems are due to a medication side effect and not due to a medical illness. What is stiffness? Think of stiffness as your body's way of telling you that something is wrong. It's not the problem itself. It's a clue that something's interfering with how your muscles, joints, or nerves are supposed to function. Now, this stiffness could be from inflammation attacking your joints, wear and tear over time on your joints, hormone imbalances, nerve problems, infections, or even your medications. It is important to understand that stiffness is a symptom, not a diagnosis. Now let's explore problems that can cause stiffness. People do not always realize that low thyroid hormone called hypothyroidism can make you feel unwell in a number of ways. You can get muscle aching, cramps, and this heavy, stiff feeling all over. Some other signs to watch for are feeling cold, unexplained weight gain, hair thinning, fatigue that won't quit, and constipation. And here's another cause people do not often think about: magnesium deficiency. Magnesium is the mineral that tells your muscles to loosen up. When you don't have enough magnesium, your muscles are unable to relax properly. They stay partially contracted, giving you that tight, stiff feeling. Next, let's talk about menopause. When estrogen levels drop during perimenopause and menopause, many women suddenly develop joint stiffness and joint pain. Estrogen actually helps with joint lubrication and inflammation control. This stiffness often improves with proper management. Now we're getting into the nervous system causes. Parkinson's disease causes a different type of stiffness. It's called rigidity. It happens because of changes in dopamine signaling in your brain. You'll often see this along with slowness of movement and tremors. Next, multiple sclerosis can cause muscle spasticity when the immune system attacks nerves in your brain and spinal cord. This comes with muscle tightness, weakness, numbness, and balance problems. Now I want to talk to you about something very rare but important: stiff person syndrome. You may have heard about this because Celine Dion has been incredibly brave in sharing her diagnosis publicly. This is an autoimmune disease that causes severe muscle rigidity and painful spasms. It usually starts in the trunk or back. Over time, movement becomes extremely limited. Celine developed progressive stiffness and spasms that affected her ability to walk and sing, which is why she had to cancel her touring. This is a challenging, life-altering condition that requires specialized treatment. Her openness has helped raise awareness of this condition. Let's not forget about infections. Lyme disease from tick bites can cause joint stiffness, muscle aches, fatigue, and headaches. Without treatment, symptoms can persist for months. But sometimes stiffness is from simpler things. Your mattress. A bad mattress can leave you waking up stiff every single morning. Overtraining. Going too hard at the gym without proper recovery strains your muscles and tissues. Your body needs pacing. Now let's talk about some rheumatology problems. Rheumatoid arthritis, known as RA, is when your immune system attacks your own joints. One of the hallmark signs is when you wake up with severe morning stiffness that lasts much longer than 30 minutes. The stiffness can affect your hands, wrists, feet, and knees. The joints might be swollen and tender. Next is polymyalgia rheumatica. This one mostly affects people over 50 years of age. Patients tell me things like, "I can hardly lift my arms," or "I can barely get out of bed." Polymyalgia rheumatica causes intense stiffness in your shoulders, hips, neck, and upper arms. And then there's lupus. This is another autoimmune condition where stiffness can occur with fatigue, joint pain, skin rashes, mouth sores, and sensitivity to sunlight. The immune system is attacking different areas of your body. Now let's talk about the most common type of arthritis, osteoarthritis. This is the slow breakdown of the cartilage in your joints over time. The stiffness in osteoarthritis is worse after sitting still or in the morning. The stiffness usually improves after 10 to 20 minutes of gentle movement. Osteoarthritis can affect knees, hips, lower back, neck, fingers, and feet. It often affects one or a few joints, unlike in rheumatoid arthritis, which commonly affects many joints. However, in some people, osteoarthritis can be in many areas. You should not assume that stiffness is just part of normal aging or something you must live with. Chronic stiffness is not normal, and it deserves a proper medical workup. If you found this video useful, please leave a like, subscribe, and share it with someone who may be helped by this. This is educational information only. See you in the next video.